So, welcome to this cardiac rehab information session on the mind and the heart connection. I'm Dr. Heather Tulloch, and I'm a psychologist and scientist at the Heart Institute. I've been working here for close to 20 years, and I've been meeting with patients and their family members over time. And I've really learned that mental health, things like stress, anxiety, and depression, are really important parts of our treatment for cardiovascular care. So, I'm really happy to talk to you today about this. What we're going to do is go through the role of mental health in cardiovascular disease, talk a little bit about stress, anxiety, and depression, and then talk how these are linked. So, what are the direct and indirect links between the mind and the heart? And then I'll talk about some of the resources that we have both here at the Heart Institute as well as in the community. But before we get started, I'm going to give you a little quiz. So, what do you think? How much or what percent do psychosocial factors contribute to an acute heart attack? So, how much do you think psychosocial factors, influence whether a person has a heart attack? So, ask yourself: is it 5%, 10%, 20%, 30%, or 40%? Well, the answer is 30%. So that's quite high when you think about it. We asked people to quit smoking, for example, and it's about the same amount. So we really do have to look at some of these factors in order to help people with their heart health. Now, one more quick quiz before I tell you some more information. Approximately what percent of patients with coronary artery disease, so the type that has blockages in the arteries, how many people meet diagnostic criteria for major depressive disorder? So what I mean by that is a clinical depression. We all have days where we're up and, have ups and downs, but this is really where there's a clinical depression where you're feeling down in the dumps for at least a 2-week period. So what percent of patients do you think have that clinical depression? Would you say it's 10%, 20%, 35%, 50%, 65%? Well, in fact, it's about 20 to 25%. So about 1 in 4 patients do experience a clinical depression. Now, I should say that a number of patients have symptoms of depression. So as much as 70% will have symptoms of depression. So it is something that we see quite a bit. Now, what is stress? I think we all have had stress in our lives. If anyone says they haven't had stress, I wonder, because of course we all have stress from day to day. Now, stress is just our body's way of responding to a demand or a threat. So when you sense danger, whether it be this tiger coming at you or whether you have to do a presentation, whether it's real or imagined, your body sort of kicks in to high gear and you have this rapid automatic process, which is known as the stress response. You've probably heard of it as the fight, flight, or freeze reaction. So that's what's happening in our body. But when do we really feel stress? Well, this is usually when there's an imbalance between the demand and the supply. So what's being asked of us and what we feel we have in the gas tank. And we feel that those things just do not match up. And again, whether it's real or perceived, when we feel like those two are not balanced, then we feel stressed. But what are the signs of stress? And I think this is one of my most important messages, that's important for us to figure out what are the signs for us that we're feeling stressed. Because stress can really creep up on you and it can even feel normal. So you may notice that it doesn't, hit you until it's really taking a toll. So we need to be aware of some of the common warning signs. So there's different categories of stress sort of signals. Sometimes it's in our body. So we might be feeling fatigued, or we might get headaches, or we might have, an upset tummy. In our mind, we might be feeling worried. Sometimes patients will tell me that they have a little hamster on the wheel and the mind is just spinning. Other times people will say that they have a difficult time making decisions, or they just don't feel like they're in judgment as good as it normally is when they're stressed. And emotionally, sometimes, you feel anxious or depressed. Sometimes you feel pretty irritable. When you're feeling stress, you just have a short fuse. And then finally, on the behavioral level, sometimes we, when feeling stressed, we might have an extra drink to take the edge off. Sometimes, we don't sleep well. Sometimes we sort of, kind of pull into ourselves and stop interacting with others. So we do things that might be a sign to us that you're feeling stress. So again, my big message here is to figure out what your signs of stress are. Everyone's sign is different. I have learned that mine is craving chocolate. So as soon as I notice I'm opening up that cupboard to get in where the chocolate is, I think, uh-oh, I'm stressed about something. What is it? So for you, it's time to figure out what it is that really is giving you that signal so that you can stop and say, okay, I need to react to this. I need to help and figure out what emotion I have so that I can handle this stress in a different way. So sometimes when we feel stressed and it's going on for a longer period of time, it can lead to anxiety or depression. And anxiety is really a part of life, and it's something that people experience from time to time. And so periods of anxiety can be completely normal. And it's actually quite normal to feel anxiety after having had a cardiac event. So stress and anxiety is something that we have, and it's part of being human. Now, but if it's something where you're feeling that it's excessive worry on a daily basis, or it's difficult to control the worries, you have a hard time sleeping, you're trying to turn off your mind, but those worries keep coming, and you feel restless or on edge. Sometimes there's muscle tension. People will talk about sort of tension in their neck or their shoulders or in their back. Sometimes problems with concentration, irritability, as I mentioned before, and also fatigue. If you're having these things and it's really difficult to control the worry, then that's where you'd like to get some help. Or I'd suggest that, help would help you. Now, clinical depression is something that we talked a little bit about at the beginning. We often use the word depressed to describe, when we're feeling down or out of sorts. And you may feel that as well at certain times, just like in anxiety. So things that, if there's a change in a job or a breakup in a relationship, or even from going from having a cardiac condition to trying to, manage that condition and a healthier life, depression can come into the picture. So what are the symptoms for depression? It's usually feeling sad or irritable or a loss of interest or motivation. I often hear from our patients that they just, I don't have the get up and go. Even though I know I enjoy certain things, I just don't feel like doing it. You can have a change in appetite. Sometimes that's wanting to eat more, sometimes it's wanting to eat less. And then, of course, there may be a change in your weight as a result of that. Insomnia or excessive sleeping is something that we often hear about as well. Sort of feeling slowed down. So if something that you're normally doing, it takes you quite a bit longer to do that. And sometimes the reverse is also feeling more agitation. We've talked about fatigue or loss of energy. But I think one of the things with depression is also feelings of worthlessness. So feeling, that you just don't have the same purpose and that you don't have something to give. And of course, in more severe depression, there's thoughts of death and suicide and just wishing that it might be easier if I wasn't around. So again, if you're feeling these symptoms, then certainly it's important to talk to someone. And I'll talk about some of the resources in a moment. Now, there is a real connection between our mental health and your heart. And so I'm going to talk about the direct and indirect connections. And this is something that we've been learning more and more about in the last, I would say, 10 to 15 years. So we don't know all of the links yet, but certainly there are some connections. Now, we know that stress triggers fat cells to release fat into the bloodstream. And if that's not burned with activity, then it's converted into cholesterol, which can lead to plaque buildup, which of course we know that we don't want. The other thing that happens when feeling stressed is that adrenaline can be released during those stressful situations. And that's a good thing, right? So you're going to be able to run off quickly if you need to. But also the platelets become stickier to enhance blood clotting. Now, again, this makes sense. If you have that, bear coming at you and you're worried that you're going to get cut, well, you want to be able to clot. However, in many of our stresses day to day now, it's less likely to be an injury that is going to occur, right? Usually now it's maybe a fight with a loved one, stress at work, where we don't need to be clotting as well. There's also changes in our nervous system. So our autonomic nervous system gets turned on and the cardiac activity gets turned on. And so sometimes with depression, there's a hyperactivity of that nervous system that gets turned on. So I think of it sort of like RPMs in a car, and you're revved up. And of course we can rev to, 3,000, 4,000 RPMs, but then when stress is gone, it goes back down. But if you think about it just revving and revving and revving, well, that's going to potentially do damage to the engine. Same idea. The good news, though, is that there is the parasympathetic nervous system, which we can turn on. And when that one gets turned on, it turns off that over-aroused sympathetic nervous system. And I'll talk about some strategies in just a moment to do that. More on the behavioral level, of course, when we're feeling stressed, anxious, or depression, you're going to have likely more sleep difficulties. And certainly that's something that you need in your recovery, both your mind and your body. As I mentioned before, usually when stressed or depressed, you may have another smoke, you might have another drink, or you might be craving more of the high fat, high sugary foods. And I can tell you when I'm stressed, I certainly don't feel like making that healthy salad. I'd much rather grab that burger, right? That's just what our body does. And so that's another way that stress is linked to heart disease. Then, of course, when we're stressed or anxious or depressed, we just don't have the same motivation to get up and do our exercises, for example. And we also sometimes don't follow doctor's orders as well, in the sense of taking your medications as prescribed or participating in cardiac rehab or other programs. So all of these things are linked. And so these are just some of the ways that, behaviorally, we can affect our heart. Now, what I will say, though, is that there's good news. And I often feel like after I've said all those other parts, it's a lot of negativity. But really, there's a lot of interventions that have been proven to improve your health, but also your cardiovascular health. So I'm going to run through a few of the tips that we've put together that have been shown to be helpful for both mental health and heart health. So you can see on the Heart Institute webpage, we have our 10 tips for emotional health, and I'll just walk through each one of these with you. So the first one, of course, is relaxation and deep breathing. So certainly, taking a bath or watching TV is important for relaxation, but deep relaxation is really required to turn off that nervous system that's on overdrive. And the most important way to do that, or most important task or activity, is deep breathing. It's really the first step in many stress management techniques, such as visualization, meditation, or progressive muscle relaxation. So we need to learn how to do deep breathing first. So I'll just ask you now to practice this with me. We'll just do a few breaths together. So this first one is called box breathing or 4 square breathing. And what you do is you inhale, counting for 4 seconds as you go along the top line of the box, hold it for 4 seconds, exhale for 4 seconds, and then hold for another 4 seconds. You can skip the hold if that feels better for you. Some people say, I don't like it, it feels uncomfortable, whereas some say, oh, I need the hold because it's what really forces me to slow down. So do whatever is comfortable to you. I also encourage you to breathe in through your nose and out through your mouth, because that as well helps slow things down. Now, of course, if you have any issues with your nose, no problem. You can breathe in and out of your mouth. So let's just do this together. I'll get you to breathe in. Here we go. Breathe in. 4, hold. 2, 3, 4, and out. Hold. 2, 3, 4, and in. 4, hold. 2, 3, 4, out. Hold. 2, 3, 4. One more. In. Hold. Out. Hold. Great. So that's something that you can practice. And what's great about box breathing is you can do it anywhere, anytime. So if you're in traffic and it's starting to get you feeling a little stressed, well, you can just practice a few breaths. This is something where all the breathing and relaxation exercises, it's not something that's going to feel natural immediately. It's something that you have to practice, just like any other skill. So I often say to people, when you go out golfing, you're not going to get a hole in one on the first tee. You need to practice. And so it's the same thing with breathing exercises. The next one that I'd like to introduce to you is diaphragmatic breathing. So the diaphragm is the dome-shaped muscle that contracts when you breathe. So what I'll ask you to do, often I get people to lie down when they do this. You can do it sitting up for now, but do practice lying down as well. So you can take one hand and place it on your chest, and then take the other hand and place it on your belly. Because what you want to do is breathe slowly so that your stomach moves out against your hand and your chest hand is still. And then when you exhale, you want to pull your stomach back in, pull those muscles inward. So we'll practice together. And I'd like you to look down and watch to see which hand is moving. And if you catch yourself, because of course, when we're stressed, it usually goes up into our chest. We have more rapid breathing, more shallow breathing. We want it to get down into the belly. So if you notice, oh, here I am up in my chest, no problem. On the next breath, I'm going to practice getting it down. So we'll do a couple breaths together. So here we go. Breathe in and out, pulling in and in and out. One more time, in and out. So I'll ask you to notice if there were any times where you felt, it was your chest rather than your stomach moving. So just keep practicing that. And I often say, try and feel like a pregnant woman, with your belly going way out. Sometimes it's good to exaggerate the movement when you're first practicing. So that's just 2 different types of breathing exercises that I encourage people to do. And there's many others that you can build on from there. So now I'm going to talk about some of the other tips in that top 10 tips for emotional health. The next one I'd like to talk about is naming your emotions. In psychology, we like to say, name it to tame it. So just naming your emotions sometimes help you be more aware and actually help you decide how you're going to react. So when I personally go into that chocolate cupboard and I realize, oh, there's a sign of stress, what am I stressed about? And then I realize, whatever it is, I'm feeling anxious. Then, okay, I'm feeling anxious about this. What is it? And now I can decide how to react. So name it to tame it. The next one is to, once you know what that emotion is try not to judge that emotion, because judging it can really make it worse. I often hear people say, oh, I shouldn't be feeling that way, or I'm being so silly to feel sad. What do I have to be sad for? I should be thankful. There's people that are worse off than I am. The fact that we're judging your emotion makes that emotion usually feel worse. So just saying, you know what? It's okay to feel sad sometimes. And then looking at what the sadness is about and trying to address that. And sort of related is that shoulds, right? So we need to stop the shoulds in their tracks. And that really puts more pressure on yourself. And so if we don't have that extra, oh, I should be doing or shouldn't be doing, it really does help to just remove that word. The next one is to know your emotional triggers. So just like you want to know what are your signs of stress, whether in your body or your mind, you also want to know what pushes your buttons. Know what makes you angry, what makes you sad, what makes you anxious. And that will help you be better prepared for future situations. So if you know, for example, that it's stressful, when to get together with a certain family member, if you can plan in advance and say, okay, I know that I get triggered in this situation, maybe I can plan for a shorter visit or, just in one situation so it's not end up being a full day. There's different things that you can plan in the future so that you're able to control some of those situations so that you're not getting triggered. The next one is move your body. Most of the time, I don't have to convince people that are participating in cardiac rehab of the importance of exercise, but that's usually their thinking for their body. It's also really important to exercise for your mind because it really does decrease anxiety, it improves your mood and depression, and it helps with our self-esteem. So get out there and do that walking, even when you're feeling stressed, because it's especially when you're feeling stressed that sometimes we ignore some of these important things. The other thing is, I always like to say to talk to someone you care about. We are social beings as humans, and it's important for us to connect. Whether we are, a person who is an introvert or an extrovert, everyone has different needs of how much they need to connect, but everyone needs to connect. So it's important to connect with others and make time for that. As I sort of alluded to before, certainly when you're feeling down and it's something that's sticking around for at least a 2-week period for depression and even longer with anxiety, there are a number of treatments that are proven to improve depression and anxiety, and cognitive behavior therapy is one of them. And that's where we look at how are you thinking, what are you doing, and how that affects your emotions. And so we do have some programs at the Heart Institute that help with or that do use cognitive behavior therapy. The next thing I like to say, and really the final one for these top 10 tips, is to really try and identify the things that make you happy and make time for them. So people might say, oh, I really enjoy fishing, for example, but I haven't done it in 10 years. Well, maybe there's something that you could schedule in. It's a weekend, it's getting together with a friend where you say, okay, we're going to go do this. And if you schedule in, you're much more likely to make it happen. And then you're going to feel better. So make sure you have that sort of me time where you're doing things that make you happy. Now I'm just going to shift and talk about a few of the resources that we have at the Heart Institute for patients that are participating in our cardiac rehab program. So we have the stress management program, which is a real skills-based program. It's a program where people learn various skills to help them manage stress. So things like the breathing exercises, as well as time management and where your values are so that you're able to really prioritize the things that are important to you. The second one is our managing emotions program. So this is for patients who have more symptoms of anxiety and depression, who need some help looking at not only some of those skills from stress management, although we include that in our managing emotion program as well, but also to look at how are you really thinking about things and what are you doing that might be keeping those negative emotions, and how can we help change certain things so that your emotions do improve. So if you're interested, please talk to our administrative assistant or your cardiac rehab mentor, or you can reach out to me as well. I also want to highlight our top 10 tips for healthy sleep, because that's something we often hear from patients after they have had a hospitalization. Their sleep is a little off. And so these are a few tips for you on that. We also have a video that's online that's about 15 minutes that also describes sleep for cardiac patients. And finally, there's some other resources that are in the community as well that people can access now, either by phone or by their computer through the internet, online programming. So I encourage you to check any of these out, as well as speak to your family doctor if needed. And finally, I always like to end with saying, we need to treat the heart, but we also need to nurture the mind. So thank you for listening, and I wish you the best in your recovery.